Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto and I have Dr. Ben Pearl here. Welcome, Ben.
Hey, thanks, Don.
Yeah,
Good to be back.
Nice to have you back. And today we're going to focus all about orthotics and also biomechanics, because I think that's a passion of yours. So, let's kind of dive right in. What I'm really excited about is you're going to talk today about kind of these little things that we can modify in our practice, implementing these little things of biomechanics and kind of make big changes with our patients. So tell me a little bit about this upcoming conference and your shoe tips, and where do you want to start?
Yeah, let's start with just biomechanics in general. I think that podiatry is losing a little bit of ground to the sports industry health gurus. So, what I mean by that is that there are a lot of podiatrists like you and I that are curious, and there are also a lot of podiatrists that are in the algorithm of what they learned from Merton, Root, and Weed. And there's nothing wrong with some of those precepts as a starting point, but we've evolved so much into the marriage of shoe, foot, orthotic, sock. All those things come together in a 7-layer cake to make the result in terms of friction, fit, balance, stability. And I think that that's where podiatry needs to hone back in, start reading more articles, start attending more things like the seminar you're putting here on today. Listen to those snippets. Don't listen just to podiatry, listen to some of the biomechanics information that is out there in biomechanics land, be it an O&P person, be it a biomechanics PhD like Ben O'Nig, be it a podiatrist from another country that may have a different bent like Simon Bartold or Simon Spooner, or many others that are out there. So I think that if we look at doing things in a stepwise fashion, and this is like a precept right out of Richard Blake's playbook. He just wrote a very lucid book, Practical Biomechanics for the Podiatrist. You couldn't get any more elegantly simple than that, in that if we take the variables that we have and add one small variable at a time, we will then know, right, what biomechanically we did to make the change.
Yeah, and so I think these are great, and I think a lot of us are probably like me. You're a little bit more advanced in biomechanics. How does someone? I'm thinking like I think that one of the biggest changes, we've gone so surgical, right? We do mostly surgery. We're trained surgical, right? We're not trained in biomechanics in our residencies. So if someone wants to kind of shift things back, and you mentioned a lot of great names, but I'm a busy podiatrist, seeing my 30 patients a day. Is there a resource? I know there's this conference coming up. Like what do you do, or what should a podiatrist do? Because we don't have all this time. We're like maybe reading this between patients. So what are some good tips?
Yeah, I think, like you say, identifying professionals that are interested in disseminating information that is a balanced approach. Yep. So look at the agenda, look at the faculty, make sure that it is not just to promote an AFO, for instance. There's nothing wrong with a good based lecture that talks about AFOs. I applaud that. It's just that we want to make sure that we're approaching both the pros and cons of the various orthopedic appliances that we're using. For instance, let's say an AFO, we all know we've had our Medicare age population come in with an AFO that they got from, let's say, another podiatrist or Hanger Labs or some other prosthetic source that has been sitting in the closet. So what we have to determine is, number one, we're looking at the patient right in front of us. Do they have the skill set to apply the brace properly? Are they going to use it more than just, for the time frame that you teach them how to apply it in your office? And is this going to be a 6-month measure or a long-term measure? And then, of course, it gets down also to making sure when we dispense them, just from a practical standpoint, that we take into mind the same and similar. If they've had a cam boot, for instance, we then have to enter the discussion of, even though this may be better for you, Mrs. Jones, we see that you've had a cam boot, this may be a problem. And then it's up to you to determine, do you want to just give them an ABN, or are you going through the appellate levels and documentation that will be required to get that device that you want covered, be it an ankle brace or some type of AFO. One of the things that I just picked up from a colleague of mine just recently, I like this idea of not just deferring to a cam boot for offloading the ankle or a fracture. So let's say we have a stable fracture. We know that when we put a cam boot on, we're going to have an inequity there with the leg length. So, and I have no affiliation with these folks whatsoever, but I really like the idea of this Taco brace that is external to the shoe. Mm-hmm. So instead of having a differential of, let's say, 1/2 inch, 3/4 of an inch, whatever the cam boot differential is, an inch, now you have minimal, because it's a external skeleton that goes around the shoe. And we've also taken out some of the compliance issues with having something internal in the shoe, where now you have something you're jamming into the shoe, creating more volume, and now it becomes a shoe fit issue.
Yeah,
in some cases.
That's a great tip. You had some other kind of real practical biomechanical tips you were going to, like what you use every day in the office. What are some of those other tips? You talked about a ball or some things like that. What are those things? Yeah.
I'm going to review those. I just wanted to finish with one little caveat that I think people should understand. When we wear a cam boot or one of these Taco braces, when we're talking about offloading vertically, we're really, as measurements go with those devices, offloading approximately 30%. That's supported in the literature. So just bear in mind that although you're offloading, it's not like 100% offload with those devices. So even though people think in their mind, oh, cam boot is the gold standard, we're really only offloading 30% on the vertical forces going through the foot and ankle. As far as some of the things that
we're going to go down this. Okay. Now, if we're going to go down this, we're going to go even more. So do you have any good options? So I've been struggling with this. Like a lot of my patients I see, let's say posterior tibial tendonitis, peroneal tendonitis, even plantar fasciitis. I don't want to put them into a cam boot. I'm going to do shockwave on them. Okay. But then I want to offload it. So I've tried like a velocity brace to offload a little bit, which is like kind of a non-custom AFO. But I would love to have an offloading brace that worked really well, that would put the pressure into the lower leg and offload the fascia or these tendons during the course of the shockwave. Do you have anything that works great as a non-custom or custom that you use frequently?
I would say that I'm very eager to see what the compliance rate will be with the Taco brace, because I think it's lighter. And from a standpoint of compliance, they've actually worked with some of the workman's comp folks that don't have, for instance, OSHA will restrict them with a cam boot to return to the workplace, but they've actually now been able to get these Taco braces. And it's an example of one brace. There's other braces out there that aren't exactly the same in terms of the offload. Does it
offload more than 30%, or is it only 30% it offloads?
No, it's a 30% brace. Yeah.
I was talking to this gentleman. I interviewed him a while ago. I forgot which one it was. He's in Colorado, but it's a brace that almost offloads 80 to 90% to the lower leg. And I don't know. I haven't found anyone locally. Like Hanger doesn't do it for me. They were a local lab that did it for them. I just thought that was a neat idea.
There are other braces that offload more. Those are going to be a compliance issue because they're more restrictive.
Okay.
Yeah. So we've heard of things like crow braces and other things that are very, they encumber the limb. So sometimes it's so, I guess, friendly for patients to wear that they defer out of that.
Yeah.
There are little things though that we can do within the shoe to use, for instance, let's just say a shoe that has a nice roller. This is a Zellerose shoe. So this is like a tank. I mean, so we used to be thinking about shoes like the Brooks Beast or the New Balance 980 as, you know, our best support shoes. But the fact of the matter is that, and I'll see if we can grab the cutaway on that Zellerose shoe. The nice thing about that, it's got a carbon Morton's extension built into the actual sole of the shoe. So not only does it have the roller, okay, but it's got an inner carbon layer that helps propulsion and built as a Morton's extension. And this is a cutaway of the shoe. It's a brilliant design. And I actually borrowed this idea because not
So you
everybody
would use that for what? Hallux limitus for?
Yes.
Okay.
Recovering predislocation syndrome submet 2. Recovering stress fracture, recovering hallux fracture, you know, so these things that don't require fixation, or if they do require fixation, you're now in week 2. And let me tell you something, I think as long as there's not swelling once the stitches are out, I would bet you that this is going to be a lot more supportive than a surgical shoe.
Good idea. That's good.
Now,
Good.
as far as price point, we're now approaching, you know, with gas being what, we're getting up into what, $5.75 a gallon. So now we've got economic pressures on patients. That's why I came up with a concept that I call small ball. So let's just get a base hit or a double instead of trying to get the home run all the time with, like we were talking before, a colostomy, a triple. Who has time now to take out of their, you know, their kid has just got over COVID, and, you know, the other kid's struggling with the IB program or AP program in school. And so you know, we have to be there for our kids and for our extended families, et cetera. So here's, for example, something that I designed. It's called the turf toe splint, but it's really more about using it for something like hallux limitus, because that's much more common for our practices than turf toe. So the premise is not to stop the range of motion, but to slow down that torque, slow down that moment, and then also to get compression, because this is like a compressive mitten-like device. And then in doing so, being adhered to the foot, I've had patients tell me that it feels like their big toe is now like Wolverine's toe, like that it's like one long bone instead of a segmented IPJ or MTP, that it gives them a sense that they're now getting a full linear axis of strength through the whole toe joint. So that's another example of something that I use every day. I'm going to show another example, and there's great places to get these. I get mine from Jill's, these carbon plates. So it's such an easy thing to use, and yet how many people actually stock these in their office? And by the way, I'm all about getting the patient better. So if a patient doesn't have, let's say $40 or whatever you decide to sell these carbon plates for the pair, if it's just in one foot, why not just sell them one and just keep that other one for the next, you know, size 10 patient? So I think if we open up our paradigm and approach to not be a one size fits all for our patients, we can then customize and get more patient compliance, you know, both from a what it feels like standpoint, and also an economic and realistic standpoint for application.
Yeah, that's great. That's great. Hey, we're coming towards a little bit of the end here in terms of time for us. Tell me a little bit about this how you guys put together this kind of biomechanics workshop, or this. Tell me a little bit about this, and if people are considering and they want to learn more about biomechanics, who would this be good for?
Yeah, this is actually good from student resident all the way up to seasoned practitioner. Because Don, there's so much new that's coming out. If you look at magazines like Lower Extremity Review, the Biomechanics journals, especially things that are being published in the UK and Australia. There's just so much going on. And why do they focus on it more over there? Because they're not as surgically focused.
Yep.
They don't do as much surgery. I'm sure there's some surgeons, I'm going to offend somebody, there might be some Australian surgeons, but it's just not as prevalent as it is here in the US. So even insofar as things like the subtalar joint neutral, Ben O'Nig talks about how it's very difficult to measure this. It's not that we have to throw that concept out the window, but there are other things. Let's think about not just what it looks like, kinematics, excuse me, but what the torque forces are through the joint. Benno has published a study where he found that you can do various wedges in shoes. And for some people, those medial and lateral wedges will influence the knee into a more of a valgus moment, and that same in another patient it'll induce a varus moment and more torque through the outside of the knee. So because we're multi-segmented, we cannot just have our eyes on the feet. As Dr. Richard Blake notes, he starts from the head. He starts looking at head tilt. He looks at shoulder drop. How does that affect the lumbar? Then we've got a referral to our osteopathic, chiropractic, orthopedic back doctor colleagues, detecting something in the hip or the back. So it's all connected. And I think that what someone is going to get out of this seminar is more connectivity, more assurance and validation that what they're doing is the correct protocol. And it's going to change their mind about a few things based on the evidence that's out there.
That's great. Underneath this, I'm going to be putting just the information. If you're listening to it, it's coming up in June, but then there'll be information about probably the replay and things like that, where that'll be at in the future. So good.
Yeah, and you can email me directly at arlingtonfoot@gmail.com, and you can get more information and make a decision if you want to sit in virtually. And we will be offering a edited a version after the fact that will be a pay-per-view, just because we want to encourage people to participate live.
Oh, cool. So that's a benefit then. So yeah, I'm going to be sending out this tweak to the list and see what people say and see if anyone's interested. And it's great. I think the trend now, what I feel is people are giving stuff for free for people that want to be present in kind of the early adopters. And then those that maybe are too busy, which is a lot of us, then for a small fee, you can watch it afterwards, have access forever. And I think that's a great way of doing it for people, giving out that information. So thanks, Ben. I appreciate your tips here, and I'll put your information underneath this video.
And I appreciate your enthusiasm and energizing me for my lunch hour. Thanks again, Don.
Yep.
All right.